everyone, another crazy week in GLP-1 news, and today is no different. Big news on the weight loss drug front. President Donald Trump has officially announced landmark deals with Eli Lilly and Novo Nordisk to dramatically cut the cost of their blockbuster obesity medications, Zepbound and Wegovy. Under the plan, the lowest doses of these GLP-1 drugs could cost as little as $149 a month, down from list prices that are over $1,000 a month. Trump called the deal a triumph for American patients that will save lives and improve the health of millions and millions of Americans. But this isn't just about cheaper drugs. It's tied to Medicare coverage, executive orders, and pharma partnerships that could reshape how weight loss drugs are priced and prescribed in the United States. Hey everyone, welcome back to the channel. No time to waste on this, so let's jump right in. The Trump administration has finalized agreements with Novo Nordisk and Eli Lilly, the companies behind Wegovy, Ozempic, Zepbound, and Mounjaro. So here is what is in the deal. First, Novo Nordisk will sell the lowest doses of Wegovy for $149 a month, extending that price across its direct-to-patient offerings. Secondly, Eli Lilly will offer Zepbound starting at $299 for the lowest dose and up to $449 for higher doses. Hey everyone, welcome back to the channel. No time to spare today. We've got to get into this. So let's talk about it. The Trump administration has finalized agreements with Novo Nordisk and Eli Lilly, the companies behind Wegovy, Ozempic, Zepbound, and Mounjaro. Here is what is in the deal. First, Novo Nordisk will sell the lowest dose of Wegovy for $149 a month, extending that price across its direct-to-patient offerings. Secondly, Eli Lilly will offer Zepbound starting at $299 for the lowest dose and up to $449 for higher doses. For Medicare beneficiaries, the out-of-pocket cost will be capped at $50 a month for Zepbound. And for Lilly's upcoming oral pill orforglipron, you've heard me talk about that one, it will start at $149 a month when it's approved. Both companies will lower their prices for key drugs under Medicare Part D, Medicaid, and self-pay channels. Novo Nordisk said it's also reviewing U.S. self-pay pricing and plans to announce new offerings for Wegovy and Ozempic in the coming weeks. For you folks that are Medicare and Medicaid, I cannot be happier for you. I have had so many people comment to me. I've read comments on other channels about how you cannot access this medication, and it looks like it's finally happening. So crack open a bottle of champagne, guys. That's a huge win. The discounts will be available through both the TrumpRx website, which is a new federal direct-to-consumer program, and also through both companies' own platforms, Novo Care Pharmacy and Lilly Direct. Novo Nordisk platform launched earlier this year helps patients without insurance or with limited coverage access Wegovy and Ozempic directly. Lilly Direct, launched in early 2024, offers Zepbound and Mounjaro straight from the manufacturer at lower prices. Through TrumpRx, the government is partnering with these existing systems, similar to a GoodRx style model, to expand access and transparency. This move also builds on Trump's most favored nation executive order, which aims to align U.S. drug prices with those in other developed countries. During his announcement, Trump said this initiative is part of his larger effort to make America's drug costs the lowest in the world. I hope he succeeds. I really do. This is a major health policy win ahead of the 2026 Medicare coverage expansion and ongoing insurer cutbacks in Medicare Advantage offerings. Both Lilly and Novo Nordisk confirmed their participation in the deal, and they've emphasized that it aligns with their shared goal of expanding access and affordability. Industry analysts call this a watershed moment for the GLP 1 drug market, but key questions remain. Will private insurers follow suit? How will these discounts impact supply given recent shortages? And will manufacturers sustain these lower prices long term without limiting availability? GLP-1 medications like Wegovy, Ozempic, and Zepbound mimic natural hormones to control appetite, improve fullness, and regulate blood sugar. Originally developed for type 2 diabetes, they're now FDA approved for obesity treatment. But access has been limited by high cost and tight supply as off label demand surged among celebrities and everyday users alike. A $149 price point could make these life changing treatments accessible to millions more, especially seniors and patients managing obesity related conditions like diabetes and heart disease. And with additional drugs like Emgality, Trulicity, and Mounjaro now discounted by 50 to 60% on Lilly Direct, the pressure is on for competitors to match these cuts. If this plan delivers, it could redefine how the United States negotiates drug prices through direct collaboration, not legislation. And that is huge. With orforglipron expected to enter the market soon and broader Medicare coverage on the horizon, this could mark a turning point for obesity treatment across America. So, what do you think? Will these new prices make weight loss drugs truly accessible, or is this more about politics than patients? Let me know your thoughts in the comments, and don't forget to subscribe for the latest updates in pharma, policy, and health tech. Thanks so much for joining today. I'll see you in the next video.